I wanted to talk about maskne today. This is the irritation and breakouts that can occur from constantly wearing a mask. And given the new state of our norm, it is a term that we should all be familiar with. So mask, acne, maskne. In dermatology, the actual medical term is acne mechanica or occlusive acne. So this is a physical form of acne where friction from the actual masks causes irritation on the skin, and the retention of heat and moisture close to the skin can cause further irritation. This irritation allows small breaks in the skin that open the door for bacteria, dirt, and oil to come in, and that humid environment kind of allows those pores to get clogged up more easily. And then further irritation from your masks, those little clogged pores get red and irritated and uncomfortable. And then you have maskne. So I wanted to go over a few skincare tips today to help us take care of our skin while we're constantly wearing a mask. First, we'll go over just general skincare tips, and then we'll go over some skincare tips that's specifically for acne-prone skin. So today we're going to go over a couple of general skin tips for mask wearers. Number 1, cleanse regularly, at least twice a day. When you cleanse the skin, you want to run the water warm, put a small amount of a gentle cleanser on the fingertips, cleanse the skin gently, and rinse with cool water. So here are some examples of gentle skin cleansers that can be found over the counter. This is a CeraVe product gentle cleanser. It comes in both a hydrating and foaming formula. They are the same type of cleansers, but the one that foams makes bubbles. Dove Sensitive Bar, this is my personal favorite. Cetaphil Gentle Cleanser, that's a gold standard of sensitive skincare. And this is a new product from La Roche-Posay, that's a gentle cleanser that's nice to use as well. So next, you want to pat the skin dry with a towel. So don't take that towel and rub, you want to kind of pat dry. Rubbing aggressively will only increase friction and irritation to the skin. So next up is to apply a moisturizer. Unless the skin is exceptionally dry, a lightweight moisturizer is recommended. The moisturizer is going to act as a barrier protection between the skin and the mask, so it helps support the function of the skin. So here are some examples of lightweight moisturizers. When you buy a moisturizer, you want to look for something that is labeled non-comedogenic, meaning won't clog the pores. So these three, this is CeraVe PM, Elta MD, and another La Roche-Posay product, are all lightweight moisturizers that can be used on a regular basis. I like my daily moisturizer to also have an SPF in it, so I've also included this Eucerin product here, as well as this Color Science product. These are moisturizers that also have an SPF, so it's like two birds with one stone. So I also have a couple of moisturizers that are going to be for drier or more sensitive skin. This is a CeraVe cream. This is not the PM formulation, so it's a little bit heavier and more moisturizing. Cetaphil moisturizer cream, Vanny cream. This is made for very sensitive skin, as is this product. It's made for allergy-prone skin, and these are all heavier moisturizers if you are on the more dry or sensitive skin side of the spectrum. If you're already on a skincare routine, you can go ahead and continue it as long as it's not causing too much irritation. This is not the time to necessarily start anything new or aggressive like spin brushes, exfoliating pads, or rough scrubs and cleansers. If you are wearing a fabric mask, wash it nightly, and you should wash it in a detergent that's made for sensitive skin like All Free and Clear or Tide for sensitive skin, or something that is labeled non-fragrance. And whenever possible and safe, remove your mask. So riding in your car and at home, you don't necessarily need your mask on, so you can take it off for those parts of the day. Okay, so next we're going to talk about skin tips for maskne. In general, these skin tips are very similar to our general set of skin tips, but with slight adjustments for that acne-prone skin. First, when you cleanse, you still want to use a fingertip cleanse, but you can add a cleanser that has an active ingredient for acne, like salicylic acid or benzoyl peroxide. This is a Neutrogena salicylic acid product. This Cetaphil product is also a very good anti-inflammatory, gentle wash for acne-prone skin. Again, you're going to pat dry with a towel. Avoid all temptation to pick at, pop, pull, or squeeze at the pimples. If it is a really uncomfortable spot and you want to do something about it, the best thing that I can recommend is to take some over-the-counter 1% hydrocortisone cream, Put a little tiny bit on your finger and apply it directly to the spot. Not like this, but like this. And you can do that twice a day until the lesion has improved. Next up, you still want to apply a moisturizer in acne-prone skin. I have included some samples of acne moisturizers here. The labeling non-comedogenic becomes especially important when moisturizing and you have acne. So this CeraVe AM product is a very good product. It is made for acne-prone skin. There is also one that is made by Cetaphil. I'm sorry I don't have a sample of it to show you here, but it is the oil-free moisturizer. It is a very high-quality product. And this one, Bare Minerals Complexion Rescue, it looks used because it is. This one is mine. So this is a acne-prone tinted moisturizer. Next up is, if you're wearing a mask and you don't necessarily need to wear makeup underneath it, feel free to skip the makeup. When you do wear makeup, it does provide a little bit more debris to get stuffed into those pores. Also, if you find that you do have a lot of debris on your mask, it may be reasonable to cleanse the skin one time during shift work. So these are very easy, disposable, gentle cleansing Cetaphil wipes. You can put in your bag at least one time during the day, wipe the face down, and then apply a clean mask. For all those men who have beard areas that can get real irritated, some shaving tips can be applied here as well. So that mask is going to rub on that shaved area's skin. So what you want to do is make sure that skin is very moisturized when you go to shave, and try to shave in the direction of the hair growth as opposed to against the grain. That will allow less irritation and inflammation in the skin. So I hope you all learned something today about general skincare and tips to take care of maskne. If your symptoms of irritation persist, despite following the discussed recommendations, then you should make an appointment with your dermatologist. If you are in need of an appointment, you can call 985-230-2778 to schedule an appointment, or visit us on the web.